Before viewing video lessons, it is important to read the textbook using the learning guide as your turn-by-turn directions. Then use the learning guide to take organized notes in your own words with examples and pictures.
In order to arrive at a diagnosis, I need an assessment of signs and symptoms. So remember, only licensed mental health professionals are qualified to assess and diagnose. Who are those people? We went through those earlier in the semester. We have psychologists. We have physicians, to include your family doctor and psychiatrist. We have advanced practice registered nurses, clinical social workers, and master's level therapists and counselors. You have to have graduate level training beyond undergraduate degree, and you have to be licensed. Those are the requirements. So, what is the purpose of an assessment? Well, we want to understand the person, and from a psychological standpoint, we want to understand their thoughts, their emotions, and their actions. We want to understand what may be going on biologically or physically. Some of these disorders involve physiological changes. And we want to understand what's going on socially. So I want to get a complete picture of the person. That will help me figure out the diagnosis, predict prognosis, plan treatment, and then also evaluate, is this treatment working? So we need to know where you're at now, so we can tell if you're improving. If you've ever gone to physical therapy, they do a great job of tracking progress, right? My daughter damaged something in her arm and elbow and wrist, and she had to go to physical therapy. She had to do all these weird exercises with her hand. She can still do them because she did them for so long. The other day I was like, remember those exercises? And she just like, she did all her little exercises. And they would periodically test her to see if her range of motion and strength was improving, right? And if it wasn't, they would mix things up. We need the same thing for psychological disorders. We talked about what made a good diagnostic system. We're going to reuse some of those words to talk about what makes a good assessment. You know how psychologists are. We like to reuse these words, but have them mean slightly different things in different contexts. Reliability and validity are going to come up 3 times today, and they're going to mean 3 different things, slightly different things each time. Okay? So a good assessment needs to be reliable. In this case, when we're talking about assessment, it needs to measure consistently. Anybody have a scale at home, like that you can weigh yourself on?
I have one, but I don't like to weigh myself on it.
I have one. It's one of the old-fashioned spring-loaded ones, you know. It's not terribly reliable, right? It seems like, oh, yay, today is a good day, you know, and then I can get back on it 10 minutes later and be like, oh, today's a horrible day, because my weight goes whoop, whoop, on the scale. It's shot. I should just throw it out, right? We need the assessment to measure consistently, right? If your ruler keeps moving how long an inch is, that would be an unreliable measure. So we're looking for something that's reliable. We're looking for something that's valid. It should measure what it says it's measuring. So I'm not going to use a tape measure to measure your weight, right? I'm going to use the right tool to fit what it is I'm measuring. And for psychological measures, much like physical health measures, we're looking for standardization. What's your temperature? What's normal? What's concerning? What's your blood pressure? What's normal? What's too high or too low, right? So we're looking for some kind of standard for this is sort of normal, average, functional. And this is, oh my gosh, there's an issue here, right? Your temperature is 105 today. Should we all be calm? No. Or should we get a little alarmed? We should get a little alarmed, right? Because we know the standardization sample, we know that there's risks when your temperature goes up that high, right? Brain damage and death are shortly following. Let's have emergency medical intervention. So we want to make sure that we have some sort of standard that we're comparing you to. So here are all the different types of clinical assessments. And as you write those down in your notes, I would just leave some blanks if you don't already have them written, because this is the slide. I'm just going to talk through these. So let's say you develop a psychological symptom and you come in for a clinical assessment. What's going on, doc? Is there anything going on? Should I be concerned? What's the deal here? You're not going to get every single one of these. What everybody gets is the first one, which is a clinical interview. Now, the clinical interview can be relatively open-ended and informal. What brings you in today? What's going on? Tell me what the deal is, right? And you just explain what's going on. Everybody gets at least that, right? Clinical interviews can also be much more formal and standardized with a set of standard questions. So we have standardized interviews to ask you specific questions to determine if it's depression or anxiety or ADHD or a personality disorder, where I have a standardized set of questions that I can use. I'm not going to give you every one of those standardized interviews, right? I might give you a standardized set of questions if that first question suggests it's ADHD or suggests it's depression, right? But everybody gets a clinical interview. And that clinical interview is going to help inform what other assessments do I need to add to this to include more formal, standardized types of clinical interviews. So everybody gets the interview. And during the interview, everybody gets the mental status exam. A mental status exam is not a set of questions I ask you. It's a set of observations I make of you. I'm assessing how with it are you today. Do you know who you are? Do you know where you are? Do you know when you are? If you're confused about those things, mental status is low, right? How coherent is your train of thought? When I ask you a question, are you able to answer that question? Do you eventually answer it, but it's this very circuitous and I have to prompt you repeatedly to finally get to the right answer, right? Or is your response so incoherent that there's not even an answer I can take from that? What is your manner? Are you jittery and hyped up and talking fast? Are you lethargic? How are you groomed? Do your clothes match? Are you wearing the same shoes or you have two different shoes on? When I was pregnant, I once went to an appointment with my OBGYN and I wore I had this old pair of beat up horrible shoes I would wear out in the yard with the dogs when they wanted to go out. And I would just slip them on and I'd go out and I'd do, the dog thing and I'd come back in. Never in a million years would I wear them out in public. I wore them to an OBGYN appointment once and I was like, if she's assessing my mental status, it's not good right now. Because I've got these horrible shoes on, right? Does it look like I'm clean? Or do I look like I'm disheveled, not taking care of myself? These are not necessarily specific questions I'm going to ask you. Have you bathed today? Right? I'm not going to ask you that. They're observations I'm going to make in my interaction with you. Okay?
So you would write down, definitely hasn't bathed. Something along those lines.
Well, I would use more technical, non-judgmental terms about talking about personal hygiene. Might be questionable. And I would also keep in mind developmental status, right? So if you've spent any time around a middle schooler, they can hop out of the shower, and I would write definitely didn't bathe because they're come out and the stink is just, it's on them because they're going through that hormonal upheaval. But I would make note of these things. And that wouldn't be a specific question. Like I said, I might ask them a question just for oriented ×3, person, place, and time. I may ask them, do you know what day it is? But if they brought themselves to the appointment and they arrived on the right day at the right time, I can probably assume that they're oriented ×3. If they arrived by ambulance to the ER, I would probably need to ask them a question to see if they're oriented ×3 because they may not be, right? So, clinical interview is sometimes all you get. That's it. We just do the interview. We have enough information to assign a diagnosis because most of our diagnoses are based on subjective criteria, right? Sometimes we add additional pieces. Physical exam is one that I frequently added when I was doing diagnosis because physical problems can have psychological symptoms. And I want that precise diagnosis. I don't want to treat somebody for anxiety if they have a thyroid disorder. Because I need to treat the source and the cause of the anxious feelings, which in this case would be a hormone. So physical exams, sometimes that may involve, some blood testing or things screening for psychological disorders. Behavioral assessments could involve me watching you and making notes of your behavior. When I worked at the clinic in Oklahoma for the kids whose mothers used drugs and alcohol while they were pregnant, we would do informal behavioral observations of the kids in the waiting room before we ever brought them back. It was a standard kind of medical waiting room. There were toys, there were other kids, there were other adults. And before we would go in and grab that kid, we would just kind of watch. How's that kid acting in that environment? We do some informal observations. Sometimes you might be asked to self-observe. So you might be asked to make notes of your own behavior in certain scenarios. Okay? You noticed yourself getting really anxious. What immediately happened before? What was going on? What were you thinking right before you had this sudden feeling of anxiety? What are the antecedents? The A, before the behavior of feeling anxious. What happened after you felt anxious? What were the consequences? The C, we call that an ABC analysis. Antecedent, behavior, consequences. So we can do this where the clinician can observe the person can observe themselves, or particularly when it comes to kids, We may ask somebody else to do the observation, like a parent or a teacher, to give us some observational information. So that's our behavioral assessment. Psychological testing is going to fall into two big broad categories initially. Each category involves a standardization sample that when you take this test, your results are compared to that standardization sample. Projective tests are a little more difficult to have a standardized sample, but they do have some standardized sort of responses that have been consistent across different diagnoses. So with projective tests, they don't have that content or face validity. They don't tell you right up front what they're looking for. By their very definition, they are nebulous and fuzzy and not really clear what it is you're looking for. So an example of this would be an ink blot test. I take some ink, I put it on a paper, just like when you were in elementary school, and you squish it together in half, and you open it up, and you got this blob of ink. It doesn't look like anything. It's not an individual object in the world, right? But when you look at it, it's kind of like looking at the clouds. Oh, you see bunny, right? Projective test says that when you look at this vague, ambiguous stimuli, you will project your issues onto it. And it'll be really hard for you to manage that social desirability bias to tell people the right answers, right? How often do you brush and floss? Every time I eat, right? That's the right answer. It's not what any of us do, but that's the right answer, right? So with this, you can't do that, right? There is no right answer. So we have ink blot test by Rorschach. We have the thematic apperception test, the TAT, which reminds me of a writing exercise that I did like in the 3rd grade. In the 3rd grade, my teacher loved to give us a picture, a little cartoon picture, and then we had to write a story about the picture. What's going on in this picture? She must have been like training to be a psychiatrist or something. She's probably diagnosing all of our neuroses when we were kids. But we give you these pictures that are vague, right? So I might give you a picture of a person kind of like this. Is that person turning away or turning towards? Are they upset? Are they happy? Are they excited? The story that you tell tells me about you, right?
Is that more scientific or pseudoscientific?
There are standardized answers and themes that we come up. So I'm not looking for your precise answer. So I don't care in the ink blot if you see a bunny. There are standardized answers that come along themes. So in the ink blots, for example, if you see movement where there is no movement, you do that once, no big deal. You do it a lot, now you're fitting a pattern.
Movement.
So I see 2 ladies dancing. That's what I see in the ink blot. You can't see dancing. They're not moving, right? The blob of ink is like this. So to occasionally see movement, not a big deal. But if you're seeing movement all over the place, that's indicative of a pattern of responses we see. Do you use the whole ink blot, or are you using small details? Do you use the negative or the positive? Do you use the white space and you see things in the white space and not the black? Some of the ink blots have colors, but most are black. Do you see color on a black object? I see a red, angry face. It's black, right? So we have standardized samples of people who with known diagnoses where we can match up these themes and we can say that is consistent with psychotic symptoms. That pattern of responding is consistent with depression. It is standardization-wise fuzzier, but there is a standardization sample.
Okay.
Yeah. Again, it doesn't come down to the exact answer. If you say you see a bunny or a frog, I don't care. Right? I care about the overall things. So projective tests are rare because they require a great deal of specialized training. So I took a semester-long class on the Rorschach. I did 5 supervised administrations in that semester, and I wasn't even close to being certified. You have to do a minimum of 13 supervised assessments, and then you have to have regular supervision and training to stay up to date on it because it is very complex. So we don't see this as much. What we see more of in the world of psychological testing are objective tests. Tests of personality, yes.
Does that mean that the projective ones may not help as much or give as much towards the diagnoses? Or is that
Well, they're
just
less likely to
simply
be
because
used because most providers aren't trained to use them. But they can be beneficial in certain circumstances. But there's other tests that can also be beneficial that I'm trained to use, so it's easier for me to use. So I'm going to use those. But I did find it very helpful once when I was diagnosing somebody eventually with schizophrenia. And the Rorschach gave me information that no other test gave me that allowed me to direct my assessment in a completely different way. I was assessing a young man who thought he had a learning disability because he was struggling in school. Ultimately, eventually figured out the reason why he was struggling in school is when he was sitting in the classroom trying to learn, he was hallucinating. And he was hearing voices and seeing things. And imagine how hard it was to concentrate on what the teacher was trying to teach. If you had this running dialogue over here and you were seeing threatening images and imagery, and he was really bright. He had the highest IQ of anybody I ever tested. So I gave him a standardized objective test of intelligence, and it was off the chart. So he was kind of like, keeping all the balls in the air with great effort. And it was only through the Rorschach that I got the first hints that it might be psychosis. And then that directed the assessment in a different direction.
So he was a really smart guy, and he thought that hearing voices and seeing threatening images around him was normal, or what was the...
It was kind of normal for him because he had actually had hallucinations since he was a child, had a family history of schizophrenia, treated very poorly in history, so had been told by his father to never, ever, ever, under any circumstances, tell anybody about those symptoms, or they would lock him up and throw away the key, which is what had happened to his grandmother.
Okay, that makes
And
sense.
so he knew it was an issue, but it was an issue he had lived with for a long time. And he also had a lot of, stigma around revealing those symptoms.
But still, he managed to get through a good deal of tests before even telling you that. That's
Right. We had done an intelligence test. We'd done some specific tests for reading disabilities and learning disabilities. The personality assessment that I gave him was an objective personality test called the MMPI. And it suggested there's something going on here. And then I gave the Rorschach the very next time I saw him. And the two of those together led me down a completely different path of discussion and inquiry with him, and also allowed us to build a trusting relationship so he got to the point where he was comfortable letting me know about what was really happening.
okay.
So personality assessments, a lot of questions, standardized against a sample. My answers match people who have depressive, anxious, psychotic, different types of symptoms. We call them personality tests because they tend to have some consistency over time, but really they're more tests of psychological symptoms. Intelligence, that one's pretty straightforward. Neuropsychological battery is tests that are designed specifically to look for neurological dysfunction. And so one of my favorites involves showing you words that are colors, so red, blue, green, but the font is colored and doesn't match the word. And so I may say, read the word, and you see a word. Oh, good. And you say blue, right? So there's some tests like that.
That's just me.
It's mean, but it's fun too. It's fun to play with. So we have sight tests. We also have images. So I can take pictures of your brain. I can take pictures of your head, right? I can take still pictures, which is what a CAT scan and an MRI do. I can also take moving pictures that show function, that show activity level in different parts of the brain. So a functional MRI, a PET scan, or a SPECT scan can do that. And then finally, there are sometimes psychophysiological assessments. So I used to be trained in biofeedback, and I would do biofeedback evaluations. I would hook people up to all different kinds of sensors. It would sense muscle tension and heart rate and respiration rate and how sweaty their palms were as measures of anxiety and stress.